Good evening. I'm Councillor Graham Bridgman and I'm Deputy Leader of West Berks Council. I am the Executive Portfolio Holder for Health and Wellbeing and I chair this board. I'm supported this evening by Councillor Joe Stewart, who is the Vice Chairman, together with other councillors in the room, Councillor Doherty, Councillor Bowick, Councillor Masters, Councillor Macro. We also have with us Matt Pearce, who's Service Director for Community and Wellbeing, and will be doing a lot of the talking this evening, I suspect. We also have Nigel Lynn, Chief Executive of the Council, Andy Sharp, who is Executive Director for the People Directorate, and we also have with us Joe Reeves. Welcome, Joe. We'll come to you in a moment. Newbury Locality Manager, Sean Murphy from the Public Protection Partnership, and Martin Dumscombe from our comms team. I think we are expecting Meredin Peachy, the Director of Public Health, and obviously when she arrives, we will welcome her. The Zoom host and taking the minutes for this evening is Gordon Oliver. We're being live streamed as usual via YouTube, and we'll start on the agenda with apologies. Gordon, do we have any apologies?
Yes, Councillor Martha Vickers sends her apologies and Councillor Alan Macro is substituting, and Katie Summers has sent her apologies and Joe Reeves is substituting for her.
Fine, thank you for that. Members, you'll recall that the last meeting was held as an urgency, and therefore we didn't have the minutes of the previous meeting at that meeting. So we've got two sets of minutes to look at, those of the 21st of September and those of the 18th of October. So I'll start by seeing whether anyone has any amendments to propose to either set of minutes. I see no one itching to amend, so I will propose them from the chair. Can I see whether that finds a seconder? Councillor Masters, thank you. Members, those in favour, stick your hand in front of the camera. Minutes agreed, and you can add my electronic signature to the extent you need to, Gordon. Okay, next item on the agenda, declarations of interest. Gordon, have we had any declarations of interest?
None in advance of the meeting, Chairman.
And I see no one raising their hand to make a declaration. So we get on to the main items on the agenda. And the first one is COVID situation report. So I'm going to ask Matt to, as he's started to share his screen, to present. Matt, over to you.
Thanks, Chair. So just going to give everyone the latest picture with regards to the epidemiology. We've seen a continued rise in our rates. So this table here just gives you a summary of the 6 local authorities, again slightly different to what you've seen before, although I did show this last week. West Berkshire is actually ranked worse across the 6 local authorities. So if you just have a look at the table, I'll take you through it. And this is from October the 14th to October the 20th. So we always ignore the last few days because they need a bit more validation. Last 7 days, the case rate for West Berkshire of all ages was 446, and that was 905.6 now. I've just seen the latest data. It's just gone slightly below that now at the upper end of 800. So that was an increase of 100% on 7 days. 60 plus case rate was 131. So again, these are those aged over 60, and that also increased to 275, which also represents a percentage increase of around 100%. So we've seen quite significant rises across our cases. And if you have a look down to the other local authorities, you can see, as I say, we're certainly the worst at this moment in time. Wokingham next up around 703. In terms of how that compares regionally, it's 526 per 100,000 and 488.5 for the national average, so nearly twice the national average. And then our positivity rate, so the proportion of those that test positive is one of the highest it's ever been, is 14.4%. On the positive, I think there are potentially some indications of a slowdown in our rates, if not a slight decline, but it's slightly too early to tell. So this is the epidemiology of cases across West Berkshire. It's just split by Pillar 1, Pillar 2. Pillar 1 is those tests in the NHS, and Pillar 2 is the community testing. I'll put the red dotted line in because that indicates when the Mensa lab was closed on the 12th of October, which, as we know, there are some issues which the Health Security Agency obviously still investigating. But as you can see, since that lab was closed, there's a significant jump in those cases. And again, the grey bar here just shows that these still need to be verified. But I think there are some signs, as I say, that rates are hopefully reducing. Nevertheless, our rates are the highest it's ever been, and we're still seeing kind of 100 to 200 cases per day. So we just need to keep a close eye on that. What I'll probably do, if that's okay, Councillor Masters, I'll take questions at the end, and I'll whiz through my slides.
Yeah, that's fine. I was just getting it hand up into.
Okay, so the next slide I thought would just really, again, just show you the positive and negative testing at Newbury Showground test site. So we've got the count of positive and negative tests on the left-hand side, and then we've got the rolling 7-day count, which is reflected by the line here. The blue bars representing negative, the amber representing positive. So again, you can see up until really the Amenza lab was closed on the 12th, there wasn't really that many positive tests coming from Newbury Showground. I do want to emphasise at this point that there's no issues with Newbury Showground. It's very much around the labs where the swabs were getting sent to. But not all swabs went to the Amenza lab. Some did actually go to other labs across the country. But again, you can see the positive cases started coming in from the 12th onwards. Again, this is quite a messy one. There are quite a lot of bar charts and graphs, but this is a positivity by age range. So you can see, I'll just flag the key ones really. Is the 10 to 14-year-olds is this grey line here. And again, you can just see from around the 10th of October onwards, there's that significant incline in positivity rates. That's the proportion of those going forward testing positive. And again, we've got the yellow amber 15 to 19 also jumping up, as well as the 5 to 9. So again, the positivity is actually really high at one point, around 45% for the 10 to 14-year-olds. In terms of the rates by ward, again, I just thought I'd show you this. This just really looks at the prior week of the 7th of October to the 13th, from the 14th to the 20th. This is actually ranked by the current rate per 100,000. So Ridgeway was top, and that saw an increase of 25 to 107. Other significant rises were Lambourne as well, 29.64, and you can see for yourself there's various different wards that have had quite a high number of cases. All of them really have seen a significant increase, which reflects our cases, and we can actually look back at many of the cases we've seen in schools and specific outbreaks in schools and how they relate to some of these wards. And again, one you will be familiar with, just really showing the different age groups, the darkest colours showing where we're seeing most of the COVID cases. And again, it's still reflecting very much in the 5 to 18 age group, specifically that 11 to 16 age group, 2,268 per 100,000. And you're also seeing that in some other ages as well, 25 to 59, I'm also seeing slight increase in cases as well. So it's inevitable, as even though you're vaccinated, you can still get the virus. If that rate goes up, it will likely spread across the other age ranges. This is actually done from Professor Christina Pagel, and one of the questions I'm being asked quite often is what is causing the rise in the rates. This is just quite a simple graph which is used from publicly available data, and I'll just explain this. So we've just got the cases per 100,000, and what we've got is the grey bar line here represents all other local authorities in England, and the red reflects those most affected local authorities by the Amenza lab. So you can actually see that those that are affected had quite a significant rise in those cases. So I think we can't say that there's a causal link between the Amenza lab and those high rates in those areas, but I think there's certainly an association and a correlation of some kind. The other thing is a new subvariant of Delta that has also just been announced as a variant of an investigation. We know that's more prevalent in the southwest as well. So it could be that variant might be increasing as it's potentially more transmissible. But as I said, it's under investigation at this moment in time, so we're not sure whether it caused more severe disease. The other hypothesis that's been put forward is that some of these local authorities have less collective immunity, so they've had less virus transmitted throughout those populations. So that could be another reason. But I think undoubtedly, that lab has had some And this map just really illustrates how you can see the impact of high rates across the south of England. So the dark colours here just showing 800 plus per 100,000. Obviously, West Berkshire here is a bit of a standout, which is in the southeast of the country. But actually, you can see, we're alongside all those other local authorities where they're seeing significant rises. Some towards the west in Swindon, around 1,200 per 100,000. So certainly rates we've not seen throughout this pandemic yet. In terms of the patients submitted to, again, this is Royal Berkshire Hospital. I understand that patients obviously go to other hospitals as well, but this is the one where most of our residents would likely go to. They still remain relatively stable. I think there is some signs of it increasing. I think there'll be some weeks before we see whether the increase in rates does have an impact on those admissions. But there are 4 new COVID admissions on the 17th of October and 4 patients were on mechanical ventilation. There has been a slight increase on those COVID-related patients in ICU as well. Only a very slight increase, but still not to the extent of what we saw during the winter period last year. And then those patients in hospital, again, it remains relatively stable, but there are 23 confirmed COVID-19 patients in hospital on the 19th of October. I think that's actually increased maybe double since the data is available here. So we're keeping a close eye on that. And again, there's pressures throughout the hospital with regards to non-COVID patients too. And I won't go into the deaths. Clearly, again, it's always unfortunate for any deaths as a result of this pandemic. There haven't been any in the last week, but prior to that, there was 1 the week before and 3 the week before that. And overall, there's a 17% increase in all-cause mortality rate compared to 5-year average. So I just really thought I'll give you a quick overview to the public about how we're responding. I'm sure my colleagues on the board will go into more detail. I think the key things for me is that obviously we're continuing to issue a range of communications, which Martin will go into, and I won't cover all of those. We know that schools have been a really a key driver, not necessarily the settings themselves in terms of our transmission rates. And what we've done is issue a letter to parents to advise on the things they can do throughout half term, how they can keep on regularly testing, stay safe through many of those measures in the first bullet point. We're also meeting with schools later this week just to consider what additional measures we can put in place to ensure a safe return from November, such as testing before children return, and other measures they might want to consider, such as face coverings in school, in communal areas. So that's a conversation we'll have with head teachers, and I know other local authorities are considering that. Just like this group, many of the key groups have stood back up, such as our local Gold Command within the council, the local Outbreak Engagement Board. Apologies for the abbreviations, I couldn't fit them all in. And then the last one was the Health Protection Board, which are having an urgent meeting tomorrow as well, just to ensure there's consistency across our local authorities to ensure we're doing all we can. And then the ongoing management, I think, happened throughout this pandemic. Outbreaks across the district we're continuing to review. So there's a slight typo there, and we're reviewing common exposure reports. That was supposed to mean, so identifying areas where we're seeing quite a number of cases that there could be a cause of transmission. Community testing, local contact tracing, and obviously with the safety advisory group reviewing events and ensuring they're conducted in a safe way. Finally, my last slide was to just quickly cover Plan B, because I know there's some questions again being asked and those conversations being had at the national level. I think really it's just to understand what that might mean if they were to come into play. We're certainly not aware of any suggestion that Plan B is going to come into place, but the sort of things that we would be considering is how we communicate the risk to the public, how they need to behave perhaps more cautiously, mandatory vaccines in terms of COVID status certification for particular settings, legally mandated face coverings in certain settings, and instruction to work from home if you can for a limited period. So those are the sort of things that if Plan B were to come into place, that we would look to support implementation across the council. As I say, we've not had any indication yet that that's currently being planned for. So I think that's probably it from me. Thanks, Chair.
Thank you, Matt. Before I come to Councillor Masters, a couple of things from me. Firstly, I just through you like to emphasise the message to the public that we're getting from the acute trusts, and I've said this before, but I don't think it harms saying again, that it is vaccination that is a key defense in this battle, and that those who are being hospitalized and regrettably maybe dying in hospital are very much seen as those who are either not vaccinated or have only had part of their vaccination program. So I think the message we need to get out, and certainly this is something we've been talking to Martin about and we'll come on to when we come on to the comms piece, is getting that message out that if you haven't been vaccinated, get vaccinated, and as soon as you're called for your booster, go and get it. I want to talk in more depth about the vaccination program, Joe, when we come to you, but just to allow Matt to maybe say anything he wants to, because I know there has been some correspondence, some communication between the chairs of the 3 health and wellbeing boards across Berkshire West. So that's me and my colleagues in Reading and Wokingham, about where we are on the vaccination program and the testing program getting out to the community, particularly in relation to the younger age range and those currently on half term, but our school children in the 12 plus age group. And finally, Matt, just one reflection, something you said made me think a little about the linkage between the possible that the areas in the country that were worst affected by COVID and had higher rates than we did earlier on in the pandemic are now seeing less community transmission, possibly because of that earlier COVID transmission in the community. I just wonder whether you'd like to reflect on that, and then I'll come to the other councillors for questions.
Yeah, that could certainly be a theory. Equally, like I say, it could be one of the reasons we're seeing higher rates than those areas is because of the what's going on at the lab. But that's certainly a plausible theory in terms of there's been more COVID transmission within some of those areas.
And before I go to the others, vaccination program.
With regards to what our approach is, Chair, sorry, I wasn't quite clear on the question.
The general position on the 12 plus and what's happening in schools in terms of getting school children vaccinated and how that program is going, because there is some concern across the local authorities in Berkshire West that particularly because the PCNs haven't been engaged in the program and because it's being delivered through community health, whether we are as far advanced in that vaccination program as we might be.
I'll probably defer to Joe to answer that more fully. I think there are some challenges we're facing in terms of capacity to deliver the vaccination program. Certainly we want as many people vaccinated as possible. When you look at some of the data, clearly those individuals that haven't been vaccinated are more vulnerable. So we certainly need to ramp that up as much as possible. I think some of the challenge we have as well is because of the vast number of children that have been isolated, because they've been positive, obviously they will have to wait a certain period, 30 days, until they can have their vaccination. So I think that will cause some delay. But yeah, I'm hoping Jo will probably cover that in more detail on her piece.
Thank you. Councillor Masters.
Thank you, Chairman. Thank you, Matt. I've got a couple of 2 or 3 questions. Matt, if we could go back to one of your slides, the hospital admissions for a moment, is that possible? Can you reshare your screen, please? Right, thank you. Yeah, there's, in your presentations, you've talked about how the hospital admissions are some way below what they were at the peak of the last wave over Christmas and New Year, for example. And it's quite clear that there's relatively speaking, there's less deaths as well. In relation to year on year, corresponding to the rates where they started rising in September last year, the rates were substantially higher than that at the beginning of September and through October this year. Are we storing up a problem in terms of hospital admissions? Yes, the mortality rate is much reduced. And in terms of the local outbreak and how severe it is, with this perceived herd immunity that we're now getting we're now maybe catching up with the rest of the country because we were so low. are we storing up a problem? How worse can it get locally? That's my first question. And not unrelated, the hard to reach communities, the socially vulnerable, homeless, etc. I know I've seen the team from the CCG and Health Watch out around the Salvation Army and the Soup Kitchen, etc. And at various charities for those who may be a bit reluctant to, such as 8 Bells, etc. And the Black and ethnic minority communities, are we reaching those in substantial numbers now, whereas we weren't before? And are we striking the right balance between education and engagement and not specific targeting of those groups too much? And that's pretty much it for your section. Thank you, Matt.
Okay, the first question I think Councillor Mass is I don't think we know, and I think me and Meriden have spoken about that at the last local outbreak engagement board about how bad it's going to get. I don't think the modelling certainly any clearer. I think you make a good point, and I think we've talked about it before, that the rates are now higher, excuse me, going into winter than what they were last year. So that does present a risk. But clearly, I think that, the vaccination programme, as Councillor Bridgman said, is clearly proving to be really successful in keeping those emissions a lot lower than what they were. So I think time will tell. And I think I've said to you before, we've got the highest rates we've ever seen at this moment in time. And I think the next couple of weeks will be quite interesting, although we know that's affected the younger age groups, whether that does actually translate into hospital admissions. So I think we'll have to wait and see. But I know the hospitals are planning for those eventualities and putting their winter plans in place. And we're supporting them as best we can to do that. In terms of hard to reach, I wasn't quite clear on that question whether we're reaching them with regards to our messaging or whether we're
reaching
engaging
them in terms of increased participation in testing. Are the in those hard to reach, are we are members of those communities getting tested at higher rates now than they were prior to the rollout of the mobile testing and target and specifically reaching those communities?
I'd say they were.
I know your team and Health Watch have been working very closely and making sure that those communities are getting the support they need. And I just wanted to know whether it was being effective and we were striking the right balance.
I think so. And again, if the LOB returns for a further meeting, I'm more than happy to bring some data back about how that programme is working. My understanding is that we are being a lot more targeted. Prior to that, we were just universal, handing out lateral flow testing kits. I think the work of Health Watch, Community United, Solutions for Health, they're all working collectively together. An example of that is going to our Afghanistan bridging hotels, providing kits to those residents, as well as other targeted forms, whether it's 8 Bells or so. I think I certainly think we are doing a really good job in that. Certainly more we can do, no doubt, and I welcome suggestions and thoughts from our voluntary sector partners about how we do that. And then I think your last question was around ethnically diverse. Again, I wasn't quite sure on the question. I think we're often listening to we welcome the eyes and ears of our community groups about what other support we can offer them. Obviously, through our communication and engagement routes, we try and do as best we can through EduCafe, again, and through Community United. So I think there's always more to be done.
I was just wanting to, similar to those hard to reach groups, how are we seeing a take up of testing higher now from the ethnically diverse groups than they were? And I thought, I thought you'd answered that actually, in your previous answer. But just moving forward, and it may be something for Sean in public protection, we've got a number of events, large events coming up, such as the fireworks at the racecourse in a week and a half's time. Are we planning to put mobile testing there to encourage people to get tested? Because that might be I don't like the phrase, a super spreader, but we're going to potentially have a lot of people in a relatively dense area, and there's a real risk that with the rates as they are at the moment, that concentration could see a potential explosion in rates thereafter. So testing people at the time and making those adequate precautions would allow us maybe to get ahead of the curve going into mid to late November.
Yeah, I don't know if Sean wants to come in, but that's certainly that's something we consider. Obviously, with the universal testing route, we encourage people to go through channels such as pharmacy, and they can order online. Obviously, our targeted mobile testing unit can target those vulnerable communities which you mentioned about, but we can certainly, ahead of any events, I know that, Sean, when we do risk assessments, we advise those event organisers to encourage anyone attending to do those tests. So we can certainly ensure we keep doing that, but I'm pretty sure we have that in hand, Sean. Am I right in saying that?
Can I suggest
Yes,
that we, Sean, hold that, and we'll come to that when you get to your PPP update. We'll bring all that together at that point.
Thank you, Matt. Thank you, Chair.
Thank you, Councillor Masters. Councillor Macro. Muted.
I'm sorry I had difficulty unmuting, as you probably guessed. Yeah, you mentioned Plan B. I read that the government had consulted councils on whether they thought that Plan B should be initiated. Is that the case? And if so, what did we say?
I'm not aware of being asked with regards to whether we support or consulted on Plan B, if I'm honest. So no is my understanding to that, or whether that went through the Director of Public Health. Merridin's not with her, so that request may have gone through her, but I'm certainly not aware of it.
Thank you.
I think Councillor Macro. Okay.
That's it. Thank you.
Okay, if there are no more questions for Matt, we'll move on to the Katie come Joe show. Joe, welcome back. Back in the same seat, I think, almost, to give us a vaccination update. Over to you.
Sorry, two screens, losing my unmute button. Katie's provided me with the following slides, which I'll share, and I will endeavour to answer your questions. I'm sure there are many. Anything I can't answer, I will save up for her when she returns from Cornwall. So just to provide some headline stats on how we're doing. First slide on the vaccination programme overall, phase 1 and 2, phase 1 being over 50s and clinically vulnerable and health and social care workers, and very little movement in take up really. So in West Berks we're at 84.7% having received a first vaccine and 78.5% having completed their primary course of vaccination. As you know, phase 2 being 50 down to 12-year-olds. We compare well across Berkshire West and across Bob, being the Buckinghamshire, Oxfordshire, Berkshire West area. We exceed take up on average across those areas. Drilling down a little bit, the 16-17-year-old take up, West Berks has 69.1% take up of a vaccine. At present, only one vaccine is recommended, although rising 18s, meaning if you are 17 and 9 months, are eligible to book their second vaccine. And again, comparing well against our colleagues in Wokingham and comparing well against the Buckinghamshire, Oxfordshire, Berkshire West performance of 62.2%. And further into the 12 to 15-year-old take up so far in West Berks, when this data was extracted nearly a week ago now on the 20th of October, West Berks performance was currently 24.6%, compared to Bob slightly higher at 25%, Wokingham taking the lead there with 38.3% take up. A lot of that will be around the scheduling of when the school-based immunisation team is visiting each schools. They are a small team. They cover the 6 local authorities across Berkshire. They are drawing on extra staff available through an agency called Medax, which has been used to staff a lot of the mass vaccination centres and the Health on the Move van. So take-up will be determined in part by their timetable of when they are visiting schools. On to care home take-up. So far, I've only got this data across Berkshire West, unfortunately. Take-up is at 25% of boosters administered versus performance across Bob of 32%. So we certainly have some catching up to do there. And just to note that the denominator here is those who have had at least 6 months since their second dose. So anybody who has not exceeded that time frame will not be included in the eligible cohort. So that brings me to the end of the slides. I will leave them up, as I imagine some questions may wish to refer to them.
Okay, if I take my usual chairman's privilege, a question about the booster program, because it is clear that those being called for their booster at 6 months seem to be getting called pretty late on in that process. And certainly if you go on the NHS website, it talks about people getting called once the 6 months is up. So it appears that people aren't getting called a couple of weeks before so that they can book their when the 6 months is up and book in. And I just wonder whether you had any comment and whether there's a way of feeding back the question to the NHS. Why are they waiting? Why are they not making those slots available in the same way that, of course, the second jab was booked at the same time as the first jab? So it was clearly being booked some months ahead. Why on earth can't you book your booster jab in advance of your 6 month trigger coming to fruition? So that's the first one. And the second one is this really trying to get to grips with why Wokingham, in terms of the school age jabs, is doing percentagely so much. I mean, it was about 13 percentage points better than West Berkshire, which in terms of a 25 to a 38% margin is a big chunk. And whether we have a feeling as to whether they are just advanced at the moment and then others will catch up, Reading will catch up, West Berkshire will catch up, or what's going on in that space.
So regarding our first question, that is something I don't have any information to explain, but I will escalate that to see whether any explanation can be given why that can't be booked in advance rather than going past the 6 month time frame until you're eligible to book. With regards to the school-based programme for 12 to 15s and the Wokingham performance versus hours, again, as I mentioned, it may well just be to do with the timetable put together by team, and they may have happened to have visited more Wokingham schools than West Berkshire so far. I'm not able to dive into that, but I can approach Virginia Garnett, who's attended this board previously, to see whether any information can be provided, and I can get something for the minutes for Gordon.
So, Andy.
Thank you, Chairman. Joe, thank you for that. It's really helpful analysis. Just a question on the younger cohorts. It does seem to be moving more slowly in terms of take-up than the other cohorts that we've seen over time. And I wondered whether we had any data around declinations. Is this something that's going to be a picture that will catch up over time, or are we getting declinations that will mean that those children, young people, are very unlikely to ever take the vaccine at this particular point in time? It will mean our numbers will stay low. Do we have any information around that?
That's not something we've discussed at the Berkshire West Vaccine Action Group yet, but that's a really interesting question. So I'll raise that at the meeting on Thursday, whether we've got any sense of rates of declination. I think conventional wisdom appears to be that we anticipate a better level of take-up, particularly now that the mass vaccination centres, for example, at Broad Street Mall, have opened up to the 12 to 15-year-old cohort. So Yes, in terms of whether the rate of catch-up should mirror what we've seen with previous age groups, I don't know, but I'll see whether any data is becoming available on that.
Thank you, Joe.
Councillor Doherty.
Thanks, Chairman. Joe, a couple of things. So first of all, you're comparing us to Bob performance. How do we have assurance that Bob performance is any good compared to the rest of the country? So, you know, obviously within the Bob arena, West Berkshire on those figures are behind quite a few of the other areas and everything else. But how do we know how we compare with the rest of the country? You know, it may be we're even worse. So it would be good to have the national performance, not just the regional performance, to make sure that we're keeping up. And I'm with Councillor Bridgman there. I'm really shocked with the West Berkshire 12 to 15-year-olds that is so far behind Wokingham, and I'd like to understand the opportunities in Wokingham versus the opportunities in West Berkshire. And I hope that Reading are asking exactly the same question about equal distribution of this. But my second question is around the booster in the care homes. Now, we know that our care home residents were one of the first cohort to be vaccinated. So given the fact that sort of thinking about my own parents who are 76 and they were in a lower down cohort, they've already been called forward. I'm really surprised at the low numbers of care home boosters, in the fact that they were one of the very, very first given the vaccination in the first place, and what measures are being put in place to go and get that up to speed, to make sure that we have the same percentage uptake as we did for the first and second vaccinations within our care homes, because obviously this is as we going into winter, we know how difficult this could potentially be. So I'd really like to understand what measures are in place for catching up on those boosters in the care home settings.
Yeah, Katie has raised that with colleagues in the primary care team at the CCG to challenge our PCNs who will be attending care homes to advise, if they have not been in yet, well, could they at least, you know, provide us a schedule so that we can make sure that our care home residents are in the best position going into winter.
Okay, that would be really good if we could share that schedule, because we know that our PCNs went out to those care homes in the first instance. I'd like assurances that that's happening again.
And I'll just comment that Reading and Wokingham are certainly raising questions about the same issues as we're discussing tonight. And indeed, we now have, I think, officers, and Andy may agree, that we've got officers talking to each other in relation to the comms that we need to put out, almost whether it's jointly or whether it's individually, but at the same time on the same subject. I don't yet know on this subject. So please be assured that there are conversations going on across Berkshire West. Councillor Stewart.
Thank you, and thank you, Leader, for raising my question for me. I just wanted to expand on it a little bit. So we just had Berkshire West numbers, and I wondered whether we actually have some West Berkshire numbers, because it may be that we are, I'd like to hope that we are better than the wider group, but it may not be. So Joe, do you know if we're able to have that sort of information?
I'm aware that's captured on a care home capacity tracker. How thorough that is as a source, I'm not able to comment on. Okay. But you know, certainly I would want to see locality level data as well, and I'm sure, and I will ask that as soon as that's available, that is provided so it can be shared with you.
Thank you, Joe, and I appreciate that you're answering questions that you possibly weren't expecting to answer. If I may, Chairman, just one further question, and this is something that's been raised by one of our residents on social media this evening, where she has said delivery of the third dose seems to be a bit hit and miss, particularly for residents with limited mobility or late stage dementia. And it's becoming a bit of an issue, especially if their carer is not tech savvy in actually being able to arrange an appointment. So it's something that she wanted particularly to be covered in tonight's session, and I think it's a really good point. So I don't know whether, Joe, you're able to talk about how we're making sure that those people with limited mobility and are not able to perhaps come in to get a third boost, to get their booster, how we're actually tackling that.
Yes, as the first time round, people who are housebound will receive their vaccine at home. In terms of those who are not tech savvy, you can call 119 to book your vaccine, and they will ask about your access requirements to make sure they refer you to a location that's most appropriate, making sure that you avoid steps, etc., if necessary, or that it's enclosed, or that it's not far from a car park, etc.
Okay, that's brilliant. Thank you. I think it was really important so that anybody that's watching will actually get that information as well.
Councillor Macro.
Thank you, Mr. Chairman. I share your frustration with the national rollout of the booster jabs, and it's a little bit worse, I think, than you're saying, because if you haven't received a letter from the NHS inviting you to make an appointment, you can't actually go online and make one until 6 months and 1 week after your last vaccination, which seems completely and utterly unnecessary and just an unnecessary delay. I also share the concerns about the low vaccination rate in our care homes, being as these people are the most vulnerable, probably have the most health issues, and also probably whose immunity wanes the quickest. So I think we really do need to understand that and get that boosted up as fast as we possibly can. And one final thing, I read somewhere that you can get a booster jab at the walk-in centre in the Kennett Centre, and I just wondered if that was in fact the case, and if so, should we be promoting it? Thank you.
Yeah, so I am aware that the pharmacy which runs the vaccination hub in the Kennett Centre, in Newbury Town Centre, is accepting walk-ins. I think feedback from over the weekend was that it was pretty oversubscribed. I would recommend that if you are able to book, you do. There's also Boots, there's Lambourne Pharmacy, and there's Broad Street Mall. So I know that the team at the Kennett Centre are working really hard to do as much as they can. But yeah, as other services, they are under a lot of pressure as well.
But can I just clarify? I take it that Nabs Lane, which is running the Kennett Centre pop-up walk-in, cannot deliver a booster to someone who hasn't hit their 6 month and hasn't effectively reached that 6 month booster period.
That's correct.
Yeah. So they can't. It's not like you can jump the queue by going to Nabs Lane. You're still in the queue. It's just a different venue for your booster. Thank you. Councillor Macro, if you still got your hand up.
Oh, sorry. Yeah. Thank you.
Councillor Masters.
Thank you, Chairman. Thank you, Joe. A couple of points. In terms of the low take-up of school-age children that we've seen and has been raised by Councillor Doherty and others have been a concern. Matt, you may be able to clarify on this. I think was it mentioned last week that if the students have got tests booked, or they were due to have tests, or they've given consent, but then they fall to a positive test, that they're no longer allowed to have it, and there was some issue about rebooking and scheduling, etc. And given that earlier in your presentation there were some slides where we were close to 40% of some school age children positivity rates, that could be one explanation for some backlog and shortfall in those numbers. If you could comment on that. And Joe, also on the school vaccination, who is administering it? Is it the NHS or is it a private company who are conducting the vaccinations, not tests? Sorry, my apologies.
Yep, so it is the NHS. It's the school-based immunisation team, which is based within BHFT, and they're drawing on additional staff from Oxford Health Trust to support them.
Okay. Are they finding it? Are they able to get the numbers of staff required, or are they falling short?
Yeah, they are at the moment, but of course they're delivering the flu programme as well, which was extended to a wider age group of children. So they've certainly got a lot more work in addition to more staff to support them.
Okay, and finally, in terms of hospital admissions and then patients who are coming out of hospital who may be eligible and going on the dates for the cohort, and in the age range, most of them will be fairly close, if not past the 6 month. Are there any guidelines for patients returning to adult social care venues in order to ensure that they've had the booster before they go back into general population? And is there any data on that moving forward? That probably come from Matt, I don't know.
Yeah, I'm not aware, so I would have to defer to somebody else to answer that question.
Yeah, I mean, going back to your first question, Councillor Masters, around, I see Andy's put his hand up. I know that the Berkshire Healthcare Foundation Trust do have a follow-up programme in place, and you're right, that may be part of the reason for the low uptake, but I suspect that that's a relatively small number of children compared to those that still haven't had a vaccination, but it's certainly a factor. And I know BHFT put that process in place to follow up those children that couldn't make it for various reasons. I don't know if Andy wants to add anything. Sorry, Chair, to take over.
No, I was going to say exactly the same thing. So, Andy.
Thank you. It's just on the care homes bit. The guidance hasn't changed in terms of returning to a care home setting. So there are still the same controls and protections in place around infection control, positive, negative tests, all that kind of stuff, to manage the flow back into care homes. No requirement for somebody to have a booster. Obviously, that's up to the individual whether they choose to have the booster or not, if they're eligible. But just to give you reassurance, the same protocols and protections are in place for return to care homes.
Is it possible you could give us was that a quick summary of those protocols, or are they a little bit more expansive?
So that's a quick summary of the protocols, but if you'd like some more detail, Councillor Masters, I can certainly provide that outside the meeting for you.
That would be great. Thanks, Andy.
And if you could share that more widely as well, please. Yeah.
Certainly.
Andy, if you'd like to share that with the board, that would be helpful. Thank you.
Will do.
Okay, that appears to be the questions on vaccination. So we now turn to the PPP, Public Protection Partnership, and Sean, all sorts to unpack from what went on earlier, and in particular in relation to events and protection of the public. Over to you.
Thank you, Chair. Yes, I'll start with events, if I may. So as Matt alluded to, these are managed through the Safety Advisory Group process, which is I suppose a multi-agency group of professionals really that look at the event plans and risk assessments that are sent in. Now, obviously, over the last 2 years, that's featured public health within that group, and we've had a lot of support from the public health team in terms of looking at those risk assessments. Just by way of a bit of background, I mean, from April till the end of September in West Berkshire, we actually had 129 event plans and notifications into that group. So there was a whole range of events. And looking ahead, we expect that to reach probably at least 150 by Christmas. So in the coming period, as you've suggested, Councillor Martins, there are a number of firework events, but also notifications we've had of things like Remembrance Day events, and even things like Santa runs, Christmas light switch-ons, Victorian markets in Newbury and Hungerford, and events in Councillor Macro's ward as well there over in Thiel. Each of those, actually, the vast majority of those have actually come with COVID risk assessments, and we are encouraging event organisers to submit a COVID risk assessment, and when they don't supply one, we follow that up as a matter of course. And those risk assessments concentrate not just on the public attending, but also on the staff or volunteers, in the case of many of the events that we've got, and look at issues around things like cleaning, testing, but actually, very importantly, some of the mitigations are in place, but very importantly, messaging for the public. And that includes messaging about prior to attending the event as to not attending with symptoms and all of that type of thing. We've also a number of certainly recently at the fair, Matt, you'll be able to confirm this. I think there was actually testing carried out or offered basically recently. I think on certainly one of the nights, And obviously, we can take away the suggestion that you had about testing, and Catherine Greaves, who deals with that, we can look at that. But just really to reassure you that we are looking at this basically very, very closely in relation to events. Obviously, what the event organisers do is only one side of the story. Basically, they can put all the mitigations in place that they can possibly can, or that we ask for them to do. But obviously, basically, the public also have to do their bit and play their bit. So just moving away from events, obviously it's been a very busy period for the service as a result of the current rates. And since the last Outbreak board meeting, which I think was a week ago, wasn't it? We have dealt with another 223 unique local contact tracing cases through the public protection team. In addition, we've dealt with a further 980 plus isolation calls and 27 hub calls, of which only 7 of those actually related to the PCR related matters. So obviously that died down after the last weekend when, as you know, we took a fair number of calls related to retesting and PCRs. I think the other area that we've really been concentrating on as a service is common exposure points. So these are exposure settings, as I think Matt alluded to earlier on, where effectively there may be 1, 2, or a number of cases basically related to that setting. Now, obviously, we drill down into the data to identify those, and obviously, as of last Friday, we had identified around about 80 of those. Now, obviously, a lot of them are schools, as you can imagine, but there are a number of those which are not schools. And we're actually still working through the data on those now to see whether there is any more that we need to do as a service, or whether there is any need to kind of escalate issues in relation to those settings. And we're working public health colleagues to do that. We're also looking as well, really, basically, as to whether there's any advice that we can give to settings, or whether any follow-up visits are needed, or whether there's any basically general community and business advice that we can provide to businesses from the Public Protection Service. As I say, it's a busy time. Basically, we have seen some stabilisation in cases, obviously, over the last couple of days. I think basically as cases have started to kind of plateau a bit locally. But we expect it to be busy going forward, certainly for the foreseeable future. That's my update, Chair. Thank you.
Thank you, Sean. I see no one wishing to ask you a question, so thank you to you. So we now move on to comms, communications update, and Martin. Martin, over to you.
Thank you very much, Chair. I just have a few slides to share with the board today. So those who don't know, I'm after that's the communications team manager. We've heard today there's been an awful lot of information sort of shared, and we're conscious that sort of for the public in particular can get sort of quite confusing in terms of actually what the most important things for them to do. So I thought it'd be useful today just to start with a very sort of short summary of really the key messages that we're using sort of through our comms. Won't be any surprises here for those of us around the table, but certainly for people at home. Actually, what are we asking people to do? We heard earlier about sort of the vaccinations being the sort of single most important thing you can do to keep yourself safe. So it's about encouraging people to be having their vaccinations, and sort of working with Jo and her team, the public health team, to really encourage people and fill in the gaps where they exist, and promote, of course, the uptake of the booster jab as well, as preventative measures to continue with the community tester and the lateral flow test devices at home twice a week, to pick up early cases, positive cases of COVID, and then sort of booking a free PCR test and beginning to isolate if people do feel unwell or have a positive test at home. And then in terms of sort of hygiene and sort of personal sort of safety and personal responsibility, it's wearing face coverings. We've heard about sort of the importance of masks, and that was discussed in the previous LOEB as well. Keeping distance and washing hands. It's useful, I think, sometimes just to sort of take a step back and actually remind people what it is that we're asking of them. Since we met, I think it was last week, we've continued to be promoting these key messages. And just to give you an example of this, we sent out another one of our newsletters to residents yesterday. You can see we sort of tried to keep it sort of as simple as possible with the bullet points and very visual with those call to actions around some of those key messages, sort of vaccines, mask wearing and lateral flow tests. This is continuing, sort of 18 months on, it's continued to get a really good reception from local residents. It goes out to about 41,000 recipients across the district. Sort of continue to get really good open rates. Sort of 30,000 people have read it since we sent it out yesterday evening, and that continues to grow. And it's actually 31,000 now. So it's grown even since I put these slides together earlier on this afternoon. And it's not just sharing the information; it's actually sort of making a difference as well. We've had more than through this new single newsletter alone, more than 1,000 clicks through to information about booking booster vaccines. So hopefully that a good chunk of those will have actually sort of taken that next step and booked their booster, or at least leave with more knowledge about when to do it and how to do it. We've had sort of 400 click-throughs to access lateral flow test devices, sort of 200 for more information about vaccines generally. So I think it just gives a sense that actually there's still an appetite sort of from residents to find out what is going on and to be doing their bit to keep themselves and others safe. And as well as these sort of general comms through our sort of channels to people more widely, we have, as Matt said, been doing some targeted outreach as well in partnership with Health Watch Risk, Berkshire Solutions for Health, and our health colleagues. So just to give you an example, this is something we've been working on this week. It's a postcard that we're going to be sort of printing and will be available over the next few days for the assisted testing team to give out when they are sort of going out to speak to those sort of harder to reach communities where they may not know so easily sort of which sort of how to access vaccines, where sort of English may not be their first language. We've deliberately tried to keep it very simple, clear call to actions, and sort of this pictorial graph just sort of showing where people can get their vaccine, and then on the flip side the addresses for that QR code, so people can use their phones to find out more, get directions to the clinics as well, and the telephone number as well. So that's something we've developed very much in partnership with health colleagues and with Health Watch West Berkshire as well, and that's something we'll continue to do as the assisted testing facilities are continued to be provided. So in terms of so what our next steps are in terms of keeping that COVID messaging going over the next couple of weeks. Pleased to say that this month we've got some additional resource coming into the comms team, so that will help us in terms of our resilience and capacity to support COVID going into those busy months, and leave us in a better position to be able to develop these approaches and to react to an constantly evolving picture. In terms of what we want to do next, actually, it's very much about keeping it simple. As I started this evening, actually, there's a lot of information. It's about breaking it down. It's about making it as easy to find and as easy to follow as possible for residents. So, to give you a couple of examples, we're planning to review the COVID pages on our website, just to make sure actually they are fit for purpose, that they're as easy for residents to follow. It's sort of grown over time, and I think overdue sort of a review of that. We're looking at the self-isolation packs, which are made available to people at home who are self-isolating as well, just to make sure they feel supported, both in terms of supports available to them and what it is that we're asking of them. Much as we want to keep it simple, we want to keep it fresh as well. These messages aren't new, and I think sort of trying to keep people engaged in them, particularly when some are sort of beginning to get a bit sort of wary or weary or switch off on the messaging, is actually sort of have a look at some new approaches and how we can just keep that very much alive. And particularly as we go into winter months and with people going to events, just reminding them what they need to do. We're working with our health colleagues too to promote flu boosters as well as COVID boosters, because we appreciate actually that's another sort of significant risk to vulnerable residents, and ties in very much with sort of COVID. We have been, as Matt said, supporting our education team and our schools at the end of last term through the sort of the issues with the PCR tests, and we'll continue to support them as they as pupils go back to school next week, and we'll wait to see what the impact of that is. And mask wearing or face coverings are again something we're very conscious of. I think it's one of the more challenging areas that we're looking at the moment. As it's sort of moved towards personal responsibility, and some are still sort of making that choice to wear them, but it's looking at how we can encourage others to as well. So with that in mind, we are working with Newbury Bid to have a look at whether there's sort of a campaign that we can run in our sort of Newbury Town Centre and more widely as well, to push face covering wearings. And we're sort of through the Newbury Bid speaking to sort of local business owners as well to see sort of what their sort of perceptions and views are in relation to that. So as I said, lots sort of for us to be sort of working on over the next couple of weeks, and more resource coming to the team, which sort of should help us towards this. But that concludes my slides, Chair, but I'm happy to take any questions.
Thank you, Martin. Indeed, I reflect that I was discussing the Lambourne Pharmacy Booster Programme with former Councillor Graham Jones yesterday. And also that indeed a couple of the walkers on the Mortimer Walking for Health walk this morning mentioned the newsletter, and that they'd received it and it was useful and so on and so forth. So we're getting those messages out, and long may that continue. Councillor Masters.
Thank you, Chairman. Martin, thank you for a very comprehensive overview of the newsletter and the strategies moving forward. I want to just focus in on social media. Since the news broke about the lab in Wolverhampton and the updates that West Berkshire Council put out on Facebook and Twitter about that and the statement, etc. Looking at the social media, there's only been one COVID-related tweet or Facebook post in that time, and that was to promote this meeting. So, is that a policy, or is that just because you've been, the department, your team are so busy that we've not been able to get that out? Because I think if obviously we're looking at trying to get our student population and our younger residents sorted. So I don't frequent TikTok or Snapchat, for example. So have you done anything directly targeted to youngsters? And what do we have a plan moving forward as rates continue to rise to reach people who are maybe on social media and don't necessarily register for the newsletter? I just think that we're missing a trick on that score, to be honest. And I think as well as doing the standard posts and tweets, etc., and whatever the relative name for it is on the other platforms, maybe we should be looking at promoting it across the district on some targeted advertising and promoting it so it actually goes into people's feeds, whether or not they actually subscribe to the West Berkshire account, that it comes into people's feeds, through a paid ad. Even if it's just promoting the newsletter to get more engagement with the newsletter. I'm actually quite shocked by the fact that we haven't been doing very much about the growing rates and the need to get vaccinated and the need to test. I'd just like your thoughts, and maybe the thoughts of any other stakeholders who are present.
Right, thank you. There's a sort of a couple of initial sort of updates I can give you, which I think will hopefully give you some reassurance in that respect. There was also some sort of at least sort of one post, I don't recall the channel, around community testing as well. So we have done other bits as well, but I think really in that last slide I presented, so the second point was around keeping it fresh. And actually we have seen that our social media engagement around COVID has dropped off. People aren't engaging with the messaging anymore. And that's really one of the things that we need to have a look at. It's all very well just sort of repeating the same messages, but if people aren't sort of paying attention to them, then it really sort of prompts us to have a look at our approach and what we can do differently. So as I said, yes, we are sort of very much looking at at what we can do differently, just to try and sort of cut through all of the noise that there is on social media and reach and get those messages out. What I can tell you is one of the sort of new posts coming, one or two new posts coming to the comms team sort of for the winter is the digital communications officer, which will give us more of a focus on our digital channels. So yes, that's sort of our newsletters, sort of some of our web page content, but sort of very much social media as well, and will give us another outlet towards that. So I'd expect to see that to see that pick up again over the next couple of weeks. So it's just about sort of finding different ways to do that. And interestingly, actually, we had a work experience, a work placement with us, spending 3 days with us last week. People who was 15 or so. So one of the things we were asking him was around actually sort of his thoughts about our engagement with the young people. And I know he had some ideas around that, and one of them was around doing some more work with schools, potentially running competition to actually sort of get sort of younger people engaged in this sort of work. So yes, it's very much on the agenda, and sort of yes, to answer your question, we have been as well sort of devoting resource to that sort of more targeted work as well, which is perhaps not so visible on social media, but having that impact with where we're doing that work with Health Watch, West Berkshire, and others. But so yeah, certainly we haven't forgotten about social media. We're looking at ways to make that more effective. I hope that answers your question, but I'm happy to take some wider views from the panel as well.
Councillor Stewart.
Thank you. I was just going to say that I had a conversation recently with a young person who looked scornfully at me when I asked them if they could see West Berks Council's posts, and actually that was on Instagram, where they said just not interested. So I think you raise an interesting point, Councillor Masters, about how we can push messages at people in with the best will in the world, because most young people are not interested in what a council's got to say, unfortunately. So I think our messaging we still very much need to rely on it going through schools, through parents, so all those people that are engaging with us through social media, and hopefully then passing those messages on. I shan't be asking a young person again whether they look at West Berks Council's tweets.
Why not?
Because I was horrified. They were horrified I was even asking. But it's a really difficult one. I don't want to labour the point particularly. I don't envy Martin and his team trying to get some difficult messages across to a whole range. We're obviously talking about those who don't have access to be able to look at all the different things on social media as well. So how do you get these important messages across everybody is a really difficult one. So I think you've done a grand job so far, Martin.
I think if I can come back on that, Councillor Stewart, I think that's one of the ways that why, if they're not engaging directly because they're not subscribed to the West Berkshire Council accounts, if they're on platforms and, like yourself, I'm somewhat 1 or 2 steps removed from the cutting edge of teenage social media activity.
I don't know what you mean, Councillor Masters.
But paid ads get into feed very targeted and very specifically, so you can actually put it in. And whether or not they engage, the presence and weight of input, it will be, you only have to look at your own Facebook and Twitter feeds. There's always a promoted ad. There's always a post from large corporations, etc. And we can be very specific and very targeted. Forgive me, I don't, the advice and anecdotal advice from a 15-year-old work experience student is great, but within our digital team, we should be we should be having people who are at the cutting edge and able to deliver. And it would be relatively simple to target 12 or 13, because I think 13 is the guideline for those platforms, and upwards, say to 18, that gets into their feeds. And it might take a few £100 a week to target the X number of hundreds of children that students that we have in that cohort. But I think it would get, and it would, that targeted aspect would get into their feeds, and they might not be clicking on to find out exactly, what's happening, but it will be there in their feed, and maybe Councillor Bridgman can do a TikTok dance to engage the TikTok generation.
Yeah,
I would certainly get a TikTok account just to see that.
I like the suggestions. I shall. I might not take them up. You never know. Councillor Macro.
I agree with Councillor Masters. We really need to try and, but despite the knockbacks we get, we really need to try and engage with these young people. Social media is the way to do it, and I think Steve's got a good point there of targeted ads for those who don't want to like the council's pages or whatever. The other thing, of course, is if things go out on social media, then other people can actually share that as well. I mean, I'm sure that those councillors who have social media accounts will do that, and other people too.
Thank you for that. I'll let Martin come back, and then we'll close this item out. Martin.
Thank you. Yeah, we have, as I said, sort of been posting on social media, and we would welcome sort of people to share and interact and comment on that. But as I said, engagement rates have been sort of dropping off. So the only still on us now to have the only still on us now is to have another look at what we can do just to make it different and actually sort of refresh some of that content. I should also sort of mention in my sort of initial response that we have done sort of targeted social media advertising in the past, and we'll continue to do so. I think sort of for the very younger age group, so sort of the 13, 14-year-olds, even though they within the terms and conditions can have a Facebook account, I think sort of the chances of them sort of being on those channels to see the ads are probably sort of low. But I like the idea of the TikTok dance, so I'll be following up with Councillor Bridgman tomorrow.
Yeah. Yes. You might get short shrift, but let's not go there. I noticed that Matt's put something in the chat about TikTok campaign. So look, let's take that away. You've heard what's been said, Martin. I leave you to follow that up. Members, we now move on to the question of future meetings. I'm going to give my view. I mean, I'm very much going to let Matt say what Matt wants to say in a moment, but my view is that we should meet at least once more. I am going to suggest meeting in a fortnight's time, principally because, in fact, Councillor Stewart and I are not available in a week's time. So if we could meet in a fortnight's time, subject to what Matt might want to say, we can then reflect on what's been said tonight and see where the numbers are going, where the numbers are and where the numbers are going, see where we are with the vaccination program, and in particular, both the boosters and the 12 plus age group and schools outbreaks. Matt, what's your view on this?
I think that'd be a good suggestion, because that'd be a week after schools have gone back as well. So although we won't have a full picture in terms of the impact on that, we can certainly report back in terms of how schools are managing and what they're seeing. So yeah, I think we should meet at least once more, and fingers crossed our rates would hopefully come down by that time.
So members, I am going to suggest, subject to obviously we need to look at the diary, we need to look at availabilities, but I'm going to suggest Monday the 8th. Gordon, take that away and consider it. And apart from, I mean, I think it'll be the standard agenda items. Obviously, it would be useful, Matt, to have Merredin, or not certain if by then it will be her successor. Well, anyway, whoever in the room with us to talk about where the public health are generally across Berkshire West. Apart from those normal items, does anyone, the other piece on this is future agenda items. I'll take it that no one's got any particular agenda items we want to discuss over and above the standard ones. And now I'll look to see whether anyone has any other business they want to raise. No, I will therefore call this meeting to a close. If you can all stay in the room while we close the live feed, Gordon.